Good afternoon. My name is Keisha Barnes, and I will be presenting a Week 5 final project for Community and Public Health with instructor Michelle Clements. Today is November 17th, 2014. Describe the role of community and public health in the well-being of population. The roles of both community and public health offer the collaboration of healthy practices and relationships implemented to develop innovative approaches that will better serve the public as well as communities effectively and efficiently. The exchange of information between the two entities create a common purpose to achieve a mutually realistic benefit. With networking, coordinating, cooperating, and collaborating, success is inevitable. According to the Hastings Center, public health encompasses what society does to assure health conditions for its members and focuses more so on populations rather than individuals. In today's society, public health is more important than ever as society faces the threats of emerging and resurgent infectious diseases, drug resistant forms of certain diseases, as well as the threat of disease through bioterrorism. The population faces an added burden of non-communicable chronic diseases such as cancers, cardiovascular diseases, diabetes, and respiratory diseases, which are exacerbated by certain behaviors associated with modern lifestyles. Lifestyles such as overeating, physical inactivity, and smoking. Due to the health risks of these preventable disorders, it has been stated that the current generation may die sooner than their parents. One of the main focuses for community and public health is the push for a healthier nation. When resources are utilized, the outcome will certainly outweigh the initiation. Describe the public health organizational structure. According to the Department of Health and Human Services, the organizational structure of the public health system was once thought of as comprising only official government public health agencies, but now it's understood to include both other public sector agencies such as schools, Medicaid, and environmental protection agencies and land use agencies, and private sector organizations whose actions have significant consequences for the health of the public. The public health system includes the following four main components: the mission, the structure, the process, and the outcome. The mission of the public health system includes its goals at any point in time and how, at the conceptual level, these goals are operationalized. At the beginning of the 21st century, the mission of public health is to ensure conditions in which people can be healthy. The structural capacity of the public health system is the cumulative resources and relationships necessary to carry out the important processes of public health. Structural capacity includes the following elements: information resources, organizational resources, physical resources, human resources, and fiscal resources. Process. The practice of public health can be thought of in terms of the key processes through which practitioners seek to identify, address, prioritize community or population, wide health problems and resources and the outputs of these more fundamental processes. Public health interventions, policies, regulations, programs, and services. The processes of public health are those that identify and address health problems as well as the programs and services consistent with mandates and community priorities. Outcome. The immediate and long-term changes experienced by individuals, families, communities, providers, and populations are the system's outcomes, the cumulative result of the interaction of the public health system's structural capacity and processes, given the macro content and the system's mission and purpose. Outcomes can be used to provide information about the system's overall performance, including its efficiency, effectiveness, and the ability to achieve equity between populations. Examine the legal and ethical dimensions of public and community health services. As stated by the Hastings Center, public health regulations involves potential trade-offs between public goods and private interests. When public health officials act, they face troubling conflicts between the collaborative benefits of population health on one hand and the personal and business interests on the other. Public health regulation is designed to monitor health threats and intervene to reduce or ameliorate harm within the population. At the same time, though, public health powers encroach on fundamental civil liberties such as privacy, bodily integrity, and freedom of movement, association, or religion. Sanitary regulations similarly intrude on basic economic liberties such as freedom of contract, use of poverty, and competitive markets. These are considered trade-offs between the collective benefits of population health and personal interest in liberty and property. Excuse me. Analyze funding of public and community health services. According to Biden, strategic planning is considered the development of a plan that integrates all organizational activities into course of action. It is perhaps the most vital entity with when the intent is geared toward propriety, successful day-to-day operations, and adventitious development. As with any business entity, an organization's adaptation comes from a multitude of strategic directional influences. These influences come from a plethora of healthcare arenas that have helped to create the blueprint when defining the future of healthcare. Direct costs are funded by, excuse me, direct costs are funded by government entities and local private funding. This covers everything from medical care to the staff providing to the educational resources. Indirect costs are each and every dime lost or unpaid due to inability to contribute by those partaking in the services offered. The continuation of these types of programs will continue to provide a cost-reducing and overall effective solution. Discuss the role of communication in community and public health programs. The creation of communicative, workable partnerships between local organizations, the state community, public health arena, and federal government gives us the means necessary to initiate and implement better health. These types of mergers will not only provide a cost-effective solution in providing care, they will increase chances of eliminating the issue at hand by utilizing a conglomerate of resources focusing on the same goal. Communication is key. This has been my presentation for week 5, final project assignment. My name is Keisha Barnes. I hope you enjoyed. Thank you.